Veneers staying in place and looking beautiful for a long time have everything to do with our home care and what we eat or don't eat. There is a small percentage of, if we're going to do a veneer, of how much solid tooth structure we have underneath. So if we have good solid tooth structure that you can put the veneer on, then it's going to stick and it's going to stay in place much longer. If the tooth underneath, the natural tooth, has had old fillings at one time put in it, if it's had a root canal, if it's been bumped, if it has a short root, if there's things that we really need to look at, pictures, x-rays, bone loss, all the things. So you want to really make sure that you're putting the right cosmetic piece of porcelain on that tooth. And in anybody's mouth, you could want to change 10 teeth on the top, and it may be a crown of veneer, a crown of veneer, a crown of veneer. It depends on how much tooth structure is underneath.
Okay.
What if there's a missing tooth? So you've got veneer, 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 missing tooth. Now you have to make that implant look like your veneers. I've had patients that I've had to redo their veneers never, and they're 20 some years old, because they are incredible at keeping them clean. Brushing, flossing, water pick, all the things, and they're very, very careful with what they eat. I have had people that are not very careful, and I've redone them in 7 or 8 years. They are tough with their teeth. They don't care. They just do what they want to do, and then they pay the consequences later. So, but they know. They'll come in and they say, "Oh, I can't believe what I did this time." So, people have veneers, but they still want to box or do crazy things at the gym. You know, it happens.